All right, ready to dive into something that maybe makes you cringe a little bit?
Oh, I know it's coming.
Root canals.
Yeah.
I know. They don't have the best rep, do they?
Not exactly a spa day, right?
But we're going to break it all down. Like, what actually happens when you have to get one done?
Separate fact from fiction, right?
Exactly. We're going full Mythbusters today.
Love it.
And we've got some really good resources for this. We've got a couple articles from the Cleveland Clinic.
Always reliable.
And a blog post from Piedmont Dental.
Oh, interesting.
They're a family dentist in Raw Hill, South Carolina.
Okay.
And actually, they are considered the top dentist for root canals in South Carolina.
Wow. Okay. Setting the bar high.
So by the end of this deep dive, you're going to know, like, everything.
Yeah.
And maybe, just maybe, you'll be a little less scared of them.
Knowledge is power. Right.
Exactly.
It is amazing how much fear there is around this procedure, though.
Right?
People don't always realize that a root canal is actually trying to save your tooth. It's all about getting rid of the infection that's way down deep inside, in the pulp.
So what exactly happens when you have root canal done? Like, can we break it down step by step?
Let's do it. Think of your tooth like a castle.
Okay,
right?
I like where this is going.
The enamel, that's that hard, shiny outer layer. That's like the outer wall of your castle.
Okay, makes sense.
Then you've got dentin underneath, a little softer, right?
Mm-hmm.
And then right in the middle, the heart of the castle, the pulp.
Okay.
That's where the nerves and blood vessels are.
Ah, so that's like the command center.
Exactly, the life force of the tooth, right?
Gotcha.
And when bacteria get down into the pulp, usually through a deep cavity or a crack, that's when the real problems start.
That's when you need the root canal.
Exactly. It's like you're sending in a special team to clean out the infection and make sure the castle is safe.
I love this analogy. This is great.
It paints a picture, right?
So walk me through it. What exactly happens when you have a root canal done?
Yeah.
Start to finish.
Okay, so first things first. The dentist is going to make sure you are completely comfortable.
Good, because that's usually the first thing on my mind.
Right. They'll numb the area, and they might even offer sedation if you're really anxious.
That's good to know.
Then they'll make a small opening in the crown of the tooth. That's the part you can see above your gums.
Okay.
That's how they get to the infected pulp.
So like a tiny little door into the tooth's inner world.
Perfect way to put it.
Okay.
Once they have access, what exactly happens when you have a root canal done is they use these really tiny instruments, super precise, to remove the infected pulp.
Okay.
All the nerves, the blood vessels, anything that's diseased. And then they clean and disinfect the whole space so thoroughly, making sure to get into all the tiny canals that go down into the roots.
Oh, wow.
That's how they make sure all the bacteria is gone.
Sounds like a very meticulous process.
It really is. It's very precise. Then they fill those canals with a material called gutta-percha.
Gutta-percha.
Yeah, it's kind of rubbery. It seals everything up. Then they put a temporary filling on top just to protect everything until you get your permanent crown.
Ah, the crown, the final touch.
Exactly. The crown is custom made, fits your tooth perfectly. They usually put it on at a follow-up appointment. That crown, it restores the shape of your tooth, the strength, how it looks, so you can bite and chew without any worries.
That's good. So what exactly happens when you have a root canal done is basically a three-part process, right?
Yeah, I like that.
Access, clean, and rebuild.
You got it. And it might sound complicated, but with all the technology we have today, it's pretty routine.
Well, that's reassuring. I already feel less intimidated.
Good, that's the goal.
So we've covered the basics of what happens during the procedure itself, but what about after? What can people expect after a root canal, recovery-wise?
The Cleveland Clinic articles really emphasize that recovery is usually pretty quick, less than a week for most people.
Okay, that's good.
You might have some mild discomfort or sensitivity for a few days, but it's really not as bad as people think.
So no marathon recovery, that's good to hear.
Nope.
What exactly happens when you have a root canal done, aftercare-wise? Any tips?
Both the Cleveland Clinic and Piedmont Dental recommend sticking to soft foods for the first few days.
Okay.
Things like yogurt, soup, mashed potatoes.
Got it.
Just avoid anything crunchy or chewy that puts pressure on the tooth.
Makes sense.
And of course, good oral hygiene, brushing, flossing, maybe even an antibacterial mouthwash.
So basically just everything we should be doing anyway, but extra carefully after a root canal.
Exactly. And if you smoke, try to cut back or quit, at least while you're healing.
Okay, good to know.
Smoking can mess with healing and can increase the risk of complications.
Good point. I think we've covered a lot here. We've looked at what exactly happens when you have a root canal done, step by step, talked about recovery and aftercare. Hmm. Before we move on, though, anything else about the procedure itself that people should know?
There's one more important thing that often gets overlooked: communication.
Hmm.
Before the procedure, talk to your dentist about anything you're worried about, any fears you have.
Yeah.
A good dentist will listen, answer your questions, and explain everything so you feel comfortable and informed.
I love that open communication. It's so important to feel like you're in good hands, especially when it's something like this.
Absolutely. And it's interesting, both the Cleveland Clinic and Piedmont Dental, that top dentist for root canals in South Carolina, by the way, they really highlight that root canals are a lot less painful than people expect.
I was just thinking pain's got to be like the #1 fear when it comes to root canals.
Totally, but the procedure uses local anesthesia. You shouldn't feel anything during the treatment.
That makes sense. What about after, though? I've heard some stories about post-root canal pain.
You might have some mild discomfort or sensitivity for a couple of days.
Yeah, but like we said before, it's usually manageable. And think about it this way. What exactly happens when you have a root canal done is it's actually getting rid of what's causing the pain, the infection.
So it's like you're taking out the bad guy that's been causing all the trouble.
Exactly. And by taking out the infected tissue, you stop the pain from spreading and causing more damage.
Okay, that makes me feel better about the pain thing.
Hmm.
But let's talk about another worry. I've heard that root canals weaken the tooth. Is that true?
It's a common idea, but it's not really true. It's the infection that weakens the tooth, not the root canal itself. In fact, what exactly happens when you have a root canal done is it helps strengthen the tooth by getting rid of that infected tissue and sealing up the canals, and then the crown gives even more support and protection so the tooth ends up stronger.
So it's like reinforcing the walls of our castle.
Exactly. Root canals are all about saving the tooth, not destroying it. Good to know. So, we've busted some myths about pain and weakening. Are there any risks, though? Any complications with root canals?
Complications are pretty rare, but it's always good to know what's possible. Sometimes the canals inside the tooth can be really narrow or curved. It makes it hard to clean and fill them completely, so there's a small chance the infection could come back even after the root canal.
And what happens then? Do they have to do the whole thing over again?
Sometimes they can do a second root canal to take care of the rest of the infection.
Oh, okay.
It's like giving the tooth another chance, but if that doesn't work or the tooth is too damaged, then they might have to take it out.
Okay, so what exactly happens when you have a root canal done isn't always a sure thing. But it seems like it works pretty well most of the time.
Absolutely. And even if the root canal doesn't completely fix the problem, it can buy you some time to look at other options. The goal is always to save your natural tooth whenever possible.
Right, because even with implants and bridges and all that, nothing really beats your own teeth. So speaking of advancements, anything new happening in the world of root canals?
It's pretty cool how much technology has changed dentistry.
Yeah.
They're always coming up with new techniques and materials to make root canals even more precise, efficient, and comfortable.
Wow.
Like some dentists are even using lasers and ozone therapy now.
Tell me more about that. How do they use lasers and ozone?
Lasers can do a bunch of different things during a root canal, from getting into the canals to sterilizing the area. Ozone therapy is really interesting too. They use ozone gas to kill bacteria and help with healing.
So what exactly happens when you have a root canal done today is probably very different from a few years ago thanks to these advancements.
Definitely. And as technology keeps improving, we can expect even more innovations. They're even doing research on regenerating the pulp tissue inside a tooth after a root canal.
Wait, really? That would be huge.
Totally. It's not just about taking out the bad stuff anymore. It's about potentially regrowing healthy tissue.
That's incredible. It sounds like the future of root canals is pretty exciting.
The field of endodontics is always pushing the boundaries.
I love that. But before we get too lost in the future, let's come back to the present. What can people do now to avoid needing a root canal in the first place?
This is where prevention comes. In all our sources, including Piedmont Dental, really emphasize good oral hygiene, brushing twice a day, flossing every day, and seeing your dentist regularly.
It's like the basics.
It is, but those simple habits can really prevent cavities and other problems that lead to root canals.
You know, it sounds so simple, but it's easy to forget sometimes.
That's true, but think about it this way. What exactly happens when you have root canal done is a lot more work than brushing and flossing.
Very true.
A little effort now can save you a lot of time, discomfort, and money later.
I gotta say, what exactly happens when you have a root canal done is way less scary than I thought it would be.
Right?
We've learned so much about the procedure, all the steps, the tech, everything.
It is amazing how much dentistry has changed.
I know. Who knew we'd be talking about lasers and ozone gas and root canals.
Right, and the possibility of regrowing the pulp tissue, that's just crazy.
It really is. But even with all these amazing new things, the main goal of a root canal is still the same.
Yep.
To save your natural tooth.
Absolutely. And that brings us right back to one of the biggest takeaways from all our sources.
Prevention.
Exactly. What exactly happens when you have a root canal done shows how skilled dentists are, but it also reminds us that we have to take care of our own oral health, too.
So true. Those everyday habits, the brushing, the flossing, the checkups, they really do matter.
They're the foundation for a healthy smile, and like we've learned today, it's always better to prevent a problem than to have to fix it, especially with something as complex as a root canal.
Well said. So what exactly happens when you have a root canal done? Now,
That's right.
we've busted some myths, we've dug into the science, and we even got a glimpse into the future of root canals.
It's been quite a journey.
And I think we demystified root canals, and hopefully you feel a little more knowledgeable and a lot less worried the next time you go to the dentist.
Hopefully, who knows, maybe you'll even impress them with all your root canal knowledge.
Maybe. But seriously, I hope this deep dive has inspired you to take control of your oral health and make those preventive measures a priority. A healthy smile is a beautiful smile.
That's a great way to put it.
Well, that's a wrap on our root canal adventure. Thanks for joining us on this deep dive. Be sure to check out the show notes for links to all the sources we used, including that helpful blog post from Piedmont Dental, family dentist in Rock Hill. They're a great resource if you're in South Carolina and looking for a top dentist for root canals.
And until next time, keep exploring, keep learning, and keep those pearly whites sparkling.